Good afternoon, everybody. It is truly my distinct pleasure to welcome you all to the first workshop of the Medical Research Volunteer Program, MRVP. In MRVP, AUB undergraduate students are matched to work on medical research projects with researchers from the AUB Faculty of Medicine on a volunteer basis. The MRVP was founded in May 2014 after a 2-year phase. Dr. Tamim from the Faculty of Medicine and myself serve as directors of the MRVP. In the last 4 years, the MRVP has grown so fast in such a short time. 444 undergraduate students have worked with 70 researchers from the AUB Faculty of Medicine on 229 projects. 18 students have already co-authored 14 publications in prestigious medical journals. You can learn about the MRVP by visiting the website www.aub.edu.lv/MRVP. We have a series of four workshops. They are listed on the slide, and they have been communicated to you by email. Today's first workshop is entitled Ethical Considerations in Clinical Research and will be delivered by Mrs. Abeer Dakik. Mrs. Dakik is an administrator and serves as an IRB member of the Biomedical Institutional Review Board, so-called IRB, where she has been working since 2009. Mrs. Dakik earned her BS in nursing and a master's degree in epidemiology from AUB. She now serves as an expert in regulatory matters that apply to human subject protections in biomedical as well as clinical research. She serves on different committees at AUBMC, such as the Quality Advisory Council and the Radiation Safety Committee. Her experience covers the review of at least 1,000 clinical research proposals from an ethical perspective. Mr. Dakik, the floor is yours.
Thank you. Thank you, Dr. Kafarani. So we're going to discuss today ethical considerations in clinical research. So let's start first with the objectives. We're going to cover history of research ethics, IRB mission, human research definition, types of review, how to submit complete applications, and essential matters to consider. So let's start with the definition of ethics. Ethics is a set of beliefs about right and wrong behavior, and it's usually difficult to determine what is right and wrong, and this may vary from one person to another. So how did all of this start? What is history of research ethics? So prior to 1906, there were no regulations regarding ethical use of human subjects in research. There was no consumer regulations, no Food and Drug Administration, no common rule, which are the updated regulations that we follow now, and there was no institutional review boards. In December 9, 1946, German physicians were charged for conducting medical experiments on thousands of concentration camp prisoners without their consent. Most of the subjects of these experiments died, and some were permanently crippled as a result. So due to this trial, in 1948, the Nuremberg Code was established, and it stated specifically that the voluntary consent of the human subject is absolutely essential, making it clear that subjects should give consent and that the benefits of the research must outweigh the risks. Please take care of this statement because I'm going to discuss it later in other slides. So what happened next? In the 1950s, there was the thalidomide experiment. And thalidomide was not approved in the United States by the FDA. It was prescribed at the time to control sleep and nausea throughout pregnancy. No informed consent was obtained. And due to thalidomide, 12,000 babies were born with severe deformities. From 1932 till 1972, there was an experiment entitled the Tuskegee Syphilis Study. And in this experiment, 400 low-income African-American males infected with syphilis were monitored for 40 years. Subjects were not told about their disease, and they were denied treatment after the availability of a proven cure. Some subjects were diagnosed as having syphilis by other physicians, but the researchers intervened to prevent treatment. And many subjects died of syphilis during the study. And it was stopped in 1973 by the US Department of Health, Education and Welfare after it was publicized and it became a political embarrassment. So these are the events these are the events related to history of research. We start with the Nuremberg trials. Because of the Nuremberg trials, the Nuremberg Code was established, and then they started writing policies and regulations until the 1979, where Belmont Report was established and written. So Belmont Report is what we base our review on currently, and it's there are 3 principles that the Belmont Report govern. And we start with respect for person. So as you noted in the Tuskegee experiment and the thalidomide experiment, patients were not informed about the study. They were not informed that they are part of a trial. So this is what the respect for person is all about informing research participants and gaining their approval to enroll them in a study. So respect for person is related to treat individuals as autonomous agents. People should not be used as means to an end. They have to choose for themselves to participate in the study, and it provides extra protections to those with diminished autonomy, like prisoners, children, pregnant women, and cognitively impaired. The next principle is related to beneficence. So also in the Tuskegee experiment and the thalidomide experiment, some subjects were harmed. Some of them died. So beneficence is related to the principle of doing no harm and trying as much as possible to maximize the benefits while minimizing the risks. Justice is when you treat people fairly and when you make sure that the burdens and benefits of the research are divided fairly across participants. So after all of this history, regulations and policies were written and IRBs were established. And what are IRBs? They are committees formally designated to review the conduct of research. In AUB, the IRB must reviews research that is conducted at AUB or by AUB faculty, students, and staff, regardless of the funding source. To protect the rights, safety, and well-being of all human subjects participating in research activities. So why is IRB review needed? As we noticed from the history, researchers tend to think more about the science than the ethics. And sometimes they tend to underestimate the risks and overestimate the benefits. So we need an independent body to review research from an ethical perspective. So the IRB reviews human subject research. And what is human subject research? We need to look at the terms research and human subject separately. Research is a systematic investigation, including research development, testing, and evaluation, which is designed in whole or in part to develop or contribute to generalizable knowledge. Human subject is a living individual about whom an investigator whether professional or student conducting research either obtains data through intervention or interaction with the individual or identifiable private information. So at AUB, we have two IRBs. We have the biomedical IRB that serves mostly research coming from the Faculty of Medicine. It's comprised of 17 voting members, 9 alternate and 2 non-voting. The members meet twice per month and they review research from an ethical perspective. Mostly they review, as I said, biomedical research. There's the social and behavioral IRB. They review research review social and behavioral research, and they're also comprised of 17 voting members, 9 alternate, 1 non-voting. They meet once per month, and they review research from all faculties at AUB. So how does the process start? The process starts with a research question. A researcher has a research question in mind. He wants to experiment on human subjects. So if human subjects are involved in the research, then they need to submit to the IRB. And to submit to the IRB, you need to know the types of review. So we review research depending on the level of risk. And can I use the internet? Yeah. Okay, so as I said, it reviews research depending on the type of risk. And the first type of review is exempt research. And exempt is less than minimal risk. What does it mean to be less than minimal risk? Usually studies that are survey-based. They are studies that do not identify participants directly. Questionnaires on non-sensitive topics. These are all under exempt review. And they're reviewed by the IRB chair. The chairperson of the IRB usually reviews this study, or the vice chair and the staff. And for a study to be exempt review, it has to fit one of the 6 criteria that I will show you now. So I will access our AUB IRB website. Seems the internet is a bit slow.
Can you try the internet here, and then I can switch?
Where? That's fine. I don't have to access it. I just wanted to show them the applications. Okay. That's fine. So we'll try to see if the I'll see if we can access it later. So I'm gonna proceed with the slides now. So as I said, exempt review, it's really less than minimal risk, and the type of projects are usually questionnaires and survey based. Expedited review, they are minimal risk research. The risk here is a bit higher than the exempt review. An example of expedited review are observational studies, reviewing medical records and extracting data from medical records, even blood withdrawal, a specific amount of blood withdrawal projects are also under expedited review. And they also are reviewed by the IRB chairperson or the vice chair of the IRB or a reviewer. And it has to fulfill one of the seven categories in the application, which I'll hope I can show you later. Then the third type of review is the full board review, and these are usually more than minimal risk. It may include, but not limited to, vulnerable population like pregnant women, prisoners, and children. It may also include or discuss sensitive topics such as sexual attitudes, use of alcohol, drugs, or other addictive products. Some studies from Faculty of Psychology are also reviewed in a full board, especially if there is deception involved. projects tackling sectarian conflict. Clinical trials, of course, are under full board. Projects that include X-rays or CT scan and genetic testing as well. So the difference between the full board review and exempt or expedited is that in a full board, projects are reviewed and discussed in a meeting with all the members there, and the decision is taken in a meeting. While the exempt and expedited, they are reviewed within the office. They're sent to a reviewer, and then a decision is taken in the IRB office, and a letter is issued to the researcher accordingly. So the timeline for IRB review is related to, of course, the type of application. So if it's exempt and it's really minimal risk, it doesn't take a lot of time for us to review this application, around 8 to 12 days. If it's expedited, it takes around 4 to 6 weeks. And if it's full board, it takes more than 4 weeks. So what needs to be submitted to the IRB? It depends on your role in the study. If your role is to submit an IRB application, you should know what you need to submit. Other than the application that I just talked about, you need to submit a study proposal, informed consent documents, questionnaires and data collection sheets, which are considered as data collection tools, recruitment material such as flyers, advertisement material, and other forms depending on the site and procedures proposed. So if your role as volunteers is to obtain informed consent, it's very important to know that the informed consent is a very important process. And it's a process that starts at the beginning of the study and continues throughout the study, because a lot of times during the study you might notice things that you didn't know before, some risks emerge you didn't know about before, and you need to inform the patients or the subjects about them. And it ends once the study finishes, because you might need to tell the participants or research subjects about the results of the study. So what are the essential elements of an informed consent? It has to include the purpose, duration of the study. It has to include that their participation is voluntary, that there is no penalty or loss of benefits. It should include the risks associated with the study. It should include a statement about confidentiality and the contact information of the researcher and the IRB. So if your role in the study is, if you have to review records, or you have to store data, or you have to analyze data, or actually work with samples, it's important to consider these two principles, confidentiality and privacy. And confidentiality is related to the data. So if you're working on a data set, you need to make sure that it's stored in a password protected laptop. You need to make sure that the people who has access to this data set is actually only the research team and no one else will know about it. The data collection sheets also should be stored in a private setting. So confidentiality is mostly related to the data, and it refers to agreements with the subjects about how the data will be handled. As I mentioned, so protected health information or research information should only be accessible in accordance with IRB approved protocols. Study files should be placed in locked areas with the access limited to the PI and the research team. Privacy is actually related to people themselves. So it's the way we protect their interest in controlling access to themselves. So you have to make sure that whenever you approach patients, it has to be in a private setting, or subjects, it has to be in a private setting in order not to breach their privacy. So after a research is submitted, and after we review the protocol, and after we issue an IRB approval letter, is it the end of the process? Unfortunately not, it's not the end of the process. We review new submissions. We review renewal of approved submissions. So after a year, we ask the researchers to submit a continuing review form to check the progress of the protocol. We review revisions of the research in case there are some minor or major amendments to the protocol. This needs to be submitted to the IRB for review and approval. We review adverse events and any problems that arise during the research, like such as non-compliance. So what does the IRB has the authority? The IRB can approve research. It can also disapprove research if the risk is too high, or it can require modifications to a protocol or defer a research. And when we usually ask for clarifications. So what's the role of the principal investigator or the researcher? They have the ultimate responsibility for the conduct of the study and the ethical performance of the research team. They're responsible for the protection of the rights and welfare of human subjects involved in the research. And they need to make sure to adhere to all the stipulations imposed by the IRB. What are your roles as volunteers? So first of all, you need to complete the required research ethical training. And it's a requirement. There are two types of ethical training, one related to biomedical and the other one is for social and behavioral. And to be able to work in a study, you need to complete this ethical training. The second thing, that you need to make sure that the study is IRB approved. If someone tells you, please help me out with this protocol, ask them, is this IRB approved? And if yes, you can work on it. And then you have to understand your exact role in the research. What are your responsibilities exactly? Are you asked to analyze data? Then you have to make sure that make sure that the data the confidentiality part is adhered to. Are you asked to obtain consent? Then review the elements of the informed consent and make sure that you're providing an adequate informed consent. And the last thing is you conduct research under the supervision of a designated physician or investigator or a faculty member. But please note that research teams are held responsible for the ethical conduct of the study. So these are our contact information, and you can call us anytime. And we can also schedule an appointment if you need to discuss a research protocol. And we're here for any questions. Yeah.
Thank you very much.
بس إذا حدا عنده سؤال أو شيء.
لا أنا حأسأل أسئلة.
أنت okay. Sure.
لا you stay. So thank you very much, Abeer. I would like to ask you and the attendees about why is this session important? Why are we giving you this session? Who has some feedback about it? So why are we asking you to attend such a session on the IRB?
Am I asking me or? Okay.
Do we need the microphones?
Yeah.
Okay.
Mainly because we need to understand the methodology and the steps we need to do while conducting research for future jobs.
So you need to understand the methodology and what are the steps need to be taken. Okay. Somebody else?
Well, because our whole lives are governed with ethics.
Okay.
So how about medical research when lives are at risk, when we are dealing with someone who might be at risk? Consent and ethics are very important, and they are the basic principles before doing medical research. So I think they are very important, and they are a very basic part of any research.
Okay. And you as potential volunteers, why do you need to do that?
Because when we want to do this research, we should know how to take consent and the basic ethics that we should abide by.
Okay. Yes, go ahead.
We need to have the correct ethics to enter this field,
Okay.
and the correct mindset. so we can deal with patients correctly and fairly.
Okay.
Yeah.
In the end, medical research is for the betterment of humanity. If we can't find a place where if we can't find the means to work correctly, to identify with other people in a right manner that serves to help them, then we would be failing not only ourselves, but later on the research that we will be conducting.
Okay.
Good
Got
shit.
you. Okay. Anybody else?
We know the rules as volunteers, and we can actually prevent any disasters that might happen.
Very nice answer. Wonderful. Abeer,
Yeah.
do you want to comment?
Yeah, well, yes, exactly. This is the purpose of this session, to know your roles as volunteers and to make sure that if you are going to work on a research project, that you take all of the principles discussed into consideration.
Anybody else want to add anything? Anybody else? Yeah?
We are as liable as a researcher in any adherence to the ethics.
Very nice
Yes,
answer.
yes.
Yeah?
Right.
She likes it. Okay.
Yeah.
Anybody else? Yes?
Also, it's when you get access, and especially in medical research, you get access to like very private info and sensitive
Exactly, yeah.
data.
Yeah.
But it's very easy to make abuse of it. So
Absolutely.
we have to know our limits. So we have to know which are the where we get to stop to not make abuses and excesses.
Okay. Somebody in the back wanted to ask to give an answer? You wanted to say something? Back. Yeah.
We need to know, especially because when we are handling special samples that contain information about people, especially about cancer and genetics, we can't really. We need to especially respect the rights.
Okay. Before I give an answer, do you want to say something?
No, I just wanted to ask if they have any questions about the IRB or about research ethics.
Okay, I think that we.
I think they know.
Yeah.
Pieces of investigating data in archives. How do we get consent from patients that already have the data?
Do you want me to?
Yeah, you know what? Let me just comment on what I just asked because I didn't close the topic yet, and then I'll transfer it to you. So I think what's really important for Dr. Bilal and myself, we have talked a lot about these workshops and with the help of the committee, and we have planned these 4 workshops, and the main objective of doing that is to introduce you to the ethical conduct of research. Now the question is, are you going to be writing a proposal and submitting it to the IRB per se? No, you're not. But we expect you, if you're going to be matched with some of the medical doctors or people who are conducting medical research, you will have some tasks that are related to IRB proposal submission and so on, or following up with the IRB. So we want you in this maybe 25-30 minutes presentation that we had, we would like you to have the understanding, the language, the common terminology that we use. So if the investigator asks you to follow up with the IRB regarding a certain submission, we would like you to understand why is the proposal submitted to the IRB, and how is it followed up, and what are the documents that are needed, and so on. At the same time, I like the answer that was mentioned about the importance of handling the documents or handling the information that you will be working with the investigator in the hospital or in any of the labs. You have to understand that you have very important documents in front of you, and you have to treat it with confidentiality, with privacy, with anonymity, and so on and so forth. So you have to really understand those. We wanted to introduce the concept of the city. Anybody has done the city certification? Okay, and the rest I would assume they have not done it, right?
Mostly are sophomores.
Mostly sophomores. So can you tell them what the city is?
Yes, I will, and maybe I try to access the internet this time. Let's see, I can guide them. Okay, great. Here it is. So, yeah. So this is our website, and you can access it through AUB website. You can go under research, and here it is, IRB, okay? Okay, so on the left, there are several icons. To access the certification that is required from you if you want to work in a research protocol, you have to go under certification. And so this is the link. It's called Collaborative Institutional Training Initiative. So once you access it, you have to actually log in. You need the username and the password. It will guide you, the website will guide you on how to do that. And the exam is usually, it's actually a course where you read specific excerpts and then you answer questions on them. And it takes around 2 to 3 hours to complete it. Okay, so I wanted to show you a bit about the website also. So these are on the left icon. These are actually the members. So the IRB, this is the biomedical IRB and the social biomedical IRB, social and behavioral IRB, and here are the members. We have a section related to policies and procedures. So a manual, our manual is very detailed. To submit to the IRB, you have to go to application submission. And if, for example, you're interested in submitting a biomedical protocol, you have to go to biomedical applications forms. And there's an exempt form, the one I already informed you about. So this is the exempt form. It's a short application, actually. Okay. So here it is. There are 6 categories. Your study should fit. The study should fit one of the 6 categories. And I'm not gonna go through them. For the expedited application, it's the same one. It's the same application is filled for both expedited and full board, and it's a longer application. And as you see, also there are 7 categories. So the study should fit one of those categories. And the application is extensive. We ask about the role of the principal investigator and the research team. We make sure that everyone has city. And we ask about the risks, recruitment strategy, and benefits. So, yeah. You can access other forms as well. We have templates for informed consents. The dates and deadlines of the IRB meetings are also posted on the website. And we have resources actually for writing proposals and PowerPoint presentations. So, and this is our contact info as well. Any questions? Hey, you had a question about the archive data, right? Okay, so you mean like data in the medical records, existing data? Yeah. So most of the times, if a researcher is interested in reviewing existing data, the IRB waives consent. We don't expect from the researcher to consent participants. But it is, this review is done on a case-by-case basis. So sometimes if the risk is high, or if for example, the patients are HIV patients, for example, and they want to review their records and it is practicable for them to consent them, then we might ask for a consent. So it depends on the case. Yeah, please.
Before applying to the IRB, are we supposed to finish the 3 hours exam?
Oh, yes, it's 2 hours, Isabel, 2 to 3. Yes, I mean, I recommend it. I really highly recommend it, because you will know a lot about ethical guidelines through the city. I really advise it. But you cannot participate in the research unless you have it.
This is from the research point of view, but from the MRVP point of view,
Okay.
you cannot submit your application, or you can submit your application, but you have to upload your city certification. So since you guys are young investigators or young students, we really we are exposing you to the whole process of research to its proper terms. So when you want to do it, or you want to be involved with a researcher in the hospital, we want to make sure that you are prepared from an ethical point of view, that you understand all these terms and you know what's right, what's wrong. And to do that, we ask you to get certification from the city. So when you fill up your profile and when you are ready to be matched to a certain investigator in the hospital or in the wherever you are matched, we ask that you upload your certification. Okay?
Yes.
In terms of authority, what if a violation occurs? What can you do? What are the measures that you can take? And is there like a Lebanese penal code that you can refer to? And what
In terms of violations, you mean in case, for example, are you talking about non-compliance?
for example?
Okay. Lebanese, there is of course a code. The Ministry of Public Health has some guidelines about conducting clinical trials. I don't think there's anything about other type of research, honestly. No, I think about only Ministry of Public Health has.
Are you planning to do?
But I'm going to reply also. So in case of non-compliance, we assess the risks. We assess the welfare of the participant. If a harm was done, the IRB at AUB, they make decisions, and sometimes they sanction researchers, as Dr. Tamim already knows, he's one of the members. So we review and assess, and we terminate protocols, we sanction researchers. Yeah.
Sometimes an investigator would have collected a lot of data, and if anything has been proven that non-compliance or something, all the data would be trashed.
Yeah.
So there are some actions that can be taken. Some actions definitely against the researchers as well.
Yeah. Both.
You don't search for it.
Eh?
How does she finish it? How does she
The city. So you just log in. There's the link. You can go to the link. You log in. You need to have a username and a password, and it guides you to actually to log into the website. The website is really easy and it's user friendly. And then there are some excerpts, like paragraphs that you need to read, and afterwards there are some questions that you need to answer. And if you answer most of them correctly, then you'll finish the certificate. It doesn't take so much time. Sometimes you can just, like, if you read them, you will notice that you already kind of know the info. It's just it's easy, I think.
Let me add something. So theoretically, whenever you are done, you'll have like a certificate that's printed in front of you. But I think the IRB office would receive a copy of your certificate, because you will be logging on the system under the AUB, and everything related to the ethical conduct will go back to the IRB. So they will have a copy of your certificate. Nevertheless, in the MRVP, we ask you to upload it on the system. Okay?
Yeah.
Where can I find the link?
Link to the city?
Yeah.
Yeah, I just told you. Here it is, on the left. This is certification. Can you see the icon?
Yeah.
Yeah. So this is the link. No,
That's it.
I'll access it. شوفوا.
Blame the internet.
I am blaming it.
Anybody has had, from those who have been involved in research, anybody had some experience with the IRB? Had anybody applied to the IRB, was involved in a research where there was an application to the IRB? None? Okay.
And you applied?
If they tell you bad stories about the IRB, don't believe them. Okay? We are good people. We do good things. So no, seriously, one thing that you will hear a lot from the investigators in the hospital and around is that the IRB takes a lot of time, and the IRB are so tough, and the IRB and so on and so forth. Well, you would appreciate that whatever we are doing is for the well-being of the patients, the people involved in research, as well as to the investigators themselves. So this is how things should be.
Yes.
Sorry, how many times can you repeat the
City?
yeah? Like if you didn't get the right answer.
I think you can repeat it as many times as you want. Yeah, I don't think you just have to have a score. I think the score is 80% or 75%. 80, I think, yeah.
So like the wrong answers show or something.
Yeah, you can just repeat it.
You have to read it again and then take the exam again.
Do you think it is for life?
3 years.
3 years? Yeah, there's a term. So after some time, you will be asked to sit for it again. And by the way, all the investigators in the hospital, they cannot do research without the city. So whether you're a research assistant or a PI, principal investigator, or a data collector or a data entry person or a statistician or whatever you are, you have to have the city certification. Any other question?
Yes.
Going back to the violation, so do you mean the research has to be submitted again after the results are done?
After, you mean you're talking about non-compliance? You're discussing non-compliance? Violations?
Violation. So in all cases, does the research have to be submitted after the results are generated?
Okay. خليني
So basically, we first need to submit our proposal to let you know about
Yeah.
the questionnaire or anything we're gonna do, and later on, after we do it and it gets
Approved.
do we need to resubmit anything or results after it's done?
Oh, when it's done, yeah. So you have to submit. Yeah. So once you submit the study and it's approved and you're done with the project, right? That's your question. Yeah, we need to submit a form. It's called closure report. So with this form, I'm going to show you the form. Here you go. So with this form, we asked for an abstract or the results of the study. Yeah. That's the form. Protocol closure report. Here it is. Okay. Any more questions?
No more questions? So let me ask you a question. Abeer, thank you very much. More for the, if we have more questions related
Sure.
to the IRB, we'll get back to you. But I'll just take another 5 minutes just to ask you about the process of research. So what are the tasks that you think
The setting was new to me فحسيت هيك إنه كتير هيك modern وهيك it was
as a medical research volunteer program participant. Yes.
That doctors and students can do autonomy.
Very general. I need a more specific.
Like the hard thing.
The hard.
The easy thing.
Bilal, I need your help. So,
Posting on Twitter or Facebook.
okay, let us hear somebody else. Yes. Okay, so data collection is one.
Maybe writing after the data is analyzed, writing.
You're all the way to the end. Yeah. So data entry, absolutely. Anybody else?
Literature and review before we start.
Wonderful. Literature review. Why do we do literature review? That's usually. Okay. So literature review. Why do you want to do literature review? Because you're establishing what's available in the literature, right? What's available out there, and you want to make sure that you're not replicating a previous study, or you're not doing something that has not been done before, or not important, or not needed. What else? What other tasks are you expected to do?
Writing a grant.
Writing a grant, wonderful. And you were talking about writing a manuscript for publication. Anybody else? There's something nobody has touched on. Data analysis, yes. How to analyze the data.
Assistance?
Hmm?
Assistance?
In what?
Conducting the experiment.
Exactly. So you're basically doing, you're assisting the investigators in so many different tasks, from the very beginning to the very end, right? From going up to the hypothesis or the question or the research question to writing the proposal, to submitting to the IRB, getting a grant, collecting the data, entering the data into the computer, analyzing the data, making sense of the data, and writing a paper. So we expect that some of you would be involved in any or many of these steps. Now, if you look at the 4 sessions that we have specified for you, and they are: 1, ethical consideration, clinical research. It's the basis, right? We don't want any problems with you, with any of you guys. We just want to make sure that when you are hooked up with an investigator, we know that you are in safe hands and they are being allocated people who know what they are doing. So we really want you to be equipped with the ethical rules of conducting research. The second one is effective literature search. I know most of you do Google search or Google Scholar or PubMed or whatever, but Ms. Haida Farha is one of the most important or most knowledgeable people in how to conduct an effective or efficient literature review. She's going to be giving you a session on the tricks of how to use PubMed and how to register with PubMed and how to use the mesh terms and so on and so forth. So on top of whatever you know about literature review, her session will be very helpful in putting things together and making sense of the search that you will be doing, which is going to be a main task that you will be involved in with researchers in the hospital. The third one is EndNote, and this is a program that's very helpful in doing in organizing the references that you have looked up. And whenever you write a proposal, a manuscript, a journal, a paper for submission, nowadays journals ask for EndNote. And Dr. Samantha Ba is also a researcher who knows a lot about EndNote, and she has delivered a few sessions of EndNote, and she will be joining us as well. Finally, myself, I will be talking about basic statistics in medicine. I will not go into the theory behind statistics. I will cover all the statistical aspects and what you guys need to know when you are dealing with a certain research project. So I will be talking about the things that you will be involved in. I will show you the SPSS program. Anybody works on SPSS? Wonderful, great. I hope next time we have such a session, I'll have more people who know how to work on SPSS. But this is going to be just an introduction. So when you sit with an investigator and they ask about a certain statistical items, you'll be able to at least understand what they are talking about. Or when you are reading a paper, you'll be able to understand what the investigators talked about in their paper. So this is why we are giving you these 4 sessions, and I hope they will be beneficial for you. But you can communicate with any of us to ask more questions or to request more topics to be covered in these workshops at the beginning of your volunteer activities.
Okay, thank you, Dr. Tamim. You see, in the MRVP, you guys, many of you have not participated in MRVP yet. In the MRVP, the students will create their profiles, and the faculty members, they will create their projects. And then, based on your interests, as well as the faculty members' needs, we will be matching you. Now, sometimes we get feedback from students that they are really enjoying what they are doing, and sometimes we get feedback that they don't like what they are doing. Why? Because they don't want to do literature search. They assume that all the research is going to the lab and cutting mice. That's not how medical research is done. So what Dr. Tamim has explained to you, that there are many processes to do research in the medical field. You may be involved at the beginning, where you are writing a grant proposal for and then get an IRB approval, or you get involved at a later stage. So the bottom line, whatever is the project you are matched on, this is something that you will eventually do in your research, if you end up doing research in the medical field. Okay? And sophomore students, you will be able to be part of the MRVP as early as the summer, the next summer. So there will be a new MRVP call in May 2018, and that MRVP call will be for the entire summer. The MRVP call right after it will be for both the fall and the spring semester. So we have 2 MRVP calls per year. Currently, we have around 67 students to be enrolled in MRVP, in the current MRVP call. And with that, you have a great evening. يعطيكم العافية.